Replicating ancient miracles, can doctors in 2026 match the speed of innovation seen in World War II field surgery? When the grid goes down and, well, the local emergency room is a smouldering ruin or, a 3-day trek away, your medical knowledge becomes the only line between a recoverable injury and a terminal diagnosis. Modern medicine has spent decades leaning on high-tech imaging and sterile, climate-controlled environments. But true survivalists know that the most effective surgical innovations were born in the mud and blood of 1940s battlefields. World War II medics didn't have the luxury of waiting for a specialist. They pioneered techniques like the debridement of contaminated wounds and the rapid administration of sulfur powders under heavy fire. To survive a true collapse today, you must master the mindset of these combat surgeons who traded institutional bureaucracy for immediate, life-saving improvisation. Field sterilization depends more on heat physics than, modern chemical cocktails. The primary hurdle in any off-grid surgical procedure is the invisible enemy of sepsis. In a sterile hospital, doctors rely on autoclaves, but a survivalist must understand the ratio of pressure to temperature to achieve true sterilization. Boiled water at sea level stays at 100 degrees Celsius, which kills most bacteria but can leave behind resilient spores that cause tetanus or gangrene. To match the efficiency of a field hospital, you should use a pressure cooker to reach 121 degrees Celsius at 15 psi for at least 30 minutes. This creates a saturated steam environment that penetrates the microscopic crevices of stainless steel tools. If you are operating without a pressure vessel, you must maintain a rolling boil for a minimum of 60 minutes and immediately use the tools while they are still hot to the touch, ensuring they never contact an unsterilized surface like a wooden table or a cloth that hasn't been scorched by an iron. Wound debridement is the most critical skill inherited from the greatest generation. World War II surgeons learned quickly that closing a dirty wound was a death sentence for the patient because it trapped anaerobic bacteria deep inside the muscle tissue. They developed a technique of aggressive debridement, which involves cutting away every piece of dead, grey or non-bleeding tissue until only healthy, oxygenated red flesh remains. In a 2026 survival scenario, you cannot afford to be squeamish about expanding a wound site to clean it. If you encounter a puncture or a jagged tear from debris, you should use a scalpel to convert the irregular opening into a clean, elliptical shape. This allows for better drainage and prevents the pocketing effect where infection festers. You must irrigate the site with a saline solution made by mixing 9 grams of salt per 1 litre of purified water, which creates a 0.9% isotonic ratio that matches human blood and prevents further tissue damage during the cleaning process. Local anesthesia can be improvised using concentrated botanical extracts or cryotherapy. The speed of World War II field surgery was often dictated by how quickly a patient could be stabilized for pain. Now, while we may not have access to morphine syrettes, the principle of nerve blocks remains the same. One of the most effective ways to manage localized pain during a procedure is the application of extreme cold to induce temporary nerve palsy. By applying a mixture of crushed ice and salt in a 3-to-1 ratio inside a waterproof bladder, you can drop the skin temperature low enough to numb the area for minor suturing or incision. For deeper issues, a survivalist should have knowledge of lidocaine equivalents, or even the historical use of high-proof ethanol as a systemic sedative. though the latter increases bleeding risks. The key is to apply the numbing agent directly to the nerve pathway leading to the wound, rather than just the wound itself, allowing for a faster and more precise surgical intervention. Hemorrhage control requires a tiered approach, starting with mechanical occlusion. Modern tourniquets like the CAT-7 are staples of the 2026 survival kit, but the World War II innovation of packing a wound is what actually saves limbs. When a major artery is nicked, a tourniquet buys you time, but the innovation lies in using plain gauze or clean cotton strips treated with a concentrated salt solution to create a physical plug. You must feed the material into the wound cavity, inch by inch, applying direct internal pressure against the bone or muscle wall. The ratio of success here is 100% dependent on the firmness of the pack. It should be tight enough that you cannot fit a finger between the packing and the wound edge. Once the bleeding is controlled mechanically, you can then focus on secondary closure methods, like the delayed primary closure used in the 1940s, where the wound is left open under a sterile dressing for 4 days to ensure no infection develops before final stitching. Suture patterns determine the speed of healing and the risk of dehiscence. Throwing a few haphazard stitches into a wound will likely lead to it ripping open under the tension of movement. Combat surgeons perfected the vertical mattress stitch, which provides both deep and superficial support, ensuring the edges of the skin are everted or turned outward. When you are stitching a deep gash, you must enter the skin about 1 centimeter away from the wound edge, go deep into the dermal layer, cross the gap, and come out the other side. Then you make a smaller pass just a few millimeters from the edges. This 2-to-1 ratio of distance ensures that the tension is distributed across a larger area of healthy skin rather than pulling on the fragile wound margins. Using a high-tensile nylon or even sterilized fishing line in an emergency can work, provided the knots are square and secured with at least 4 throws to prevent unraveling during physical exertion. If you found this breakdown of tactical medicine and historical field surgery valuable, make sure to subscribe to the channel for more deep dives into hardcore survival skills. Share this guide with your team and your local community to ensure that when the systems fail, the knowledge remains. Stay prepared, stay sharp, and keep training for the world that is coming.